presentation will again deal with core tools of integrative medicine. Dr. Delaney is board certified in internal medicine and anti-aging, and he has extensive training and practice in functional medicine as well as European biological medicine. Please welcome Dr. Delaney.
Thank you so much. Thank you very much for letting me share my favorite tools. I found I'm an internist cardiologist in Boston, and I've been in practice over 30 years, and it's great to come to meetings, learn things, apply them, give them to your patients, see the benefits, and then come here and share that with you. So I hope to do that today. The Electro Equiscope. I've been using this piece of equipment for the past 3.5 years. Every living creature is electrical in nature. Just like Dr. Tennant said, the key thing is to put voltage into the body to increase ATP. Unhealthy cells don't have the same resonating frequency, restoring electrical homeostasis. If a low energy cell is able to be charged up to normal, the cell can begin to heal. It's so true. It is so true. An imbalanced autonomic nervous system is a feature of many, many chronic illnesses. This device instantly corrects it. You know, when you see a patient who has chronic inflammation and it just sits there, and you put the probes across the joint, you can see it begin to swelling to go down right away before they leave the office. 60% the pain is improved because what we've instantly done is begin to allow the body to heal from the inside out. The brain recognizes this signal. It's a microvoltage. Apoptosis is a healthy process. The cell begins to say, I'm dying, and it coalesces. When it's necrotic and it ruptures, your immune system sees it and begins causing autoimmune disease. So you want to have cells die healthy, but you also want to be able to keep the cells from becoming necrotic and exploding. And restoring energy to the cells accomplishes that purpose. So we have an EEG, we have EMG, EKG. We shock people to bring them back. We should be treated electrically. And we should use a machine that has this capability to do that. Historically, I'm going to swing through this. In the Baghdad batteries, they made an electrical device. People used to step on fish that put electrical impulses to help them heal in the early days. These are the articles that document the efficacy of this product. A TENS unit tricks the body into not knowing the pain is going to the brain. It doesn't cause healing. That's macro voltage. This is C fiber, goes up to the brain, and if you input a signal here and make it a beta fiber, they don't feel the pain as much. It doesn't correct the problem. It helps reduce the pain. This is the study, chronic back pain in 1983, performed by the person who invented this machine. And they treated 40 patients with chronic back pain. They treated them with microcurrent stimulation, placebo versus the simulation. And the patients, 37% of patients got the pain relieved, the others didn't, and later they were much improved. I see this every day. I treat the lower back, and the pain markedly improves. And 3 treatments moves them along the path of health. The conclusion was that what now we know, it enhances membrane potential, it enhances ATP production, it reduces inflammation. They got the Nobel Prize for realizing that voltage-sensitive ion channels exist, and our own bodies use the same frequency to open these. There's these voltage ion channels, and when there's a normal gradient across that channel, good stuff goes in and bad stuff comes out. When they're blocked, the patient has pain. And so when we actually put the signal back to the body, these voltage channels open up and become healing and begin dumping their toxins and receiving the vital healthy products they have not been able to get in. In summary, it searches and discovers abnormalities in the body's electrical system. The patient guides you. When a person comes in, they have pain, you find out where the pain is and see if the body can hold charge. You put the probes on the body and it can hold charge. So you dial it up until they hold charge, and you then go through different frequencies, and at each frequency they hold charge, and when you stop, for that period of time, those cells have opened. And it's almost like an entrainment. As you give patients repeated doses of the voltages that are designed by the protocols, the cell begins to recover. It infuses charge to the channels, it allows waste removals to leave. The body normally has an impedance that stops the body from opening up these channels. When you use this piece of equipment, it rapidly changes and allows the system to rebalance. So it's a new tool. It's a tool when acute injury occurs and affects different sites within the body. The current medical approach is we isolate it, we put ice on it, we give them anti-inflammatories, and we send them home. When someone gets an acute injury, I get them to my office, I instantly put them on the machine, treat them for 30 minutes, bring them back the next day, the swelling goes away, and you prevent the secondary inflammation where you can't heal. It allows it to heal from the inside out. It's a new mechanism of disease. It's allowed me to become a more integrative doctor. These are the tools behind it. This is the key probes. There are protocols. These are the ones I typically use, so there's the basic protocols, plus then we give them a systemic protocol. And let me see if I can show you. And then different frequencies, you start at 0.5 frequency, that has a wide bandwidth, and then you clear, then you move to 2.5 megahertz, 5 megahertz, 10 megahertz, and 40. And the beam that you're putting in gets more and more narrow, and that progressively entrains the body to hold the charge. Here's a wide right probe on the back. This is a lymph drainage. You can bring up the lymph up the leg, up to the groin. This is guided meditation. You put the people in the right type of meditation using alpha waves, when you put it right on the head to get them comfortable. These are the frequencies. Hands and feet is systemic. And the teeth, just as the teeth were important in the other slide, so too here. There's a probe where you go through every tooth to find out there's inflammation if it holds its charge. When I took training in California, there was a person in my group, a woman, and we did this probe on her 14th tooth, severe pain. And she said, I had just had breast surgery. I mean, the connection between the tooth and the organs are amazing. Again, that's why thinking about it, looking at these things, it really kind of opens your mind. And it was a left breast and the left side, sort of like my lady with the left lung. All right, then in addition to that, we have reflexology. So if someone has a sinus problem, if you stimulate the sinus, it helps. So that the technology can be not only used in the local areas, but in the teeth, for reflexology, for the palms, in the ears. If you want to treat the knee, you put a thing into the ear where the knee is. So the body is, you can do this integrative treatment by using various methods to treat the same different organs, and improve the patient and bring them back on a regular basis.